Hello, this is Dr. Alexander Haskell. I'd like to discuss one of the four primary causes for why we develop symptoms, and that would be a low-grade systemic chronic underlying infection. So these infections can be bacteria and mold, viruses, and parasites, although parasites is going to be limited to the intestinal tract, so this is really more about the first three, which are circulating within our cardiovascular system. So bacteria, the blood, we were trained that the blood is sterile. There is not or should not be any infectious agents in the blood. But on this continuum from being completely sterile, no bacteria or any organisms in the blood, all the way to septicemia is a long gradient, so to speak, and when it gets to the level of septicemia, the bacteria are overwhelming the system, and you can actually culture the person's blood for bacteria to see if there is bacteria. It usually shows up if there is septicemia. But if there's some bacteria, then it won't culture, and therefore a lot of people are having health issues because of these underlying low-grade systemic infections, because of the toxins they're producing, creating inflammation and a wide variety of symptoms. So the first step, of course, is to do some blood testing, looking at the white blood cell count, number of white blood cells in circulation. Often if there's an acute infection that's recent, then you'll find a high white blood cell count as the immune system is responding appropriately. But in chronic infections, we often see a low white blood cell count, and most physicians don't consider a low white cell count as one possible indication of a chronic infection that's been around for a while. So how to determine if there's an underlying infection? If blood work, if the person's not septic, they've got some bacteria or mold, whatever, how can we go about determining if there is an underlying infection? So ideally, we want to actually look at live blood to see if there is these infections. So dark field microscopy has been around for decades, and it's remarkable what you can see about or in the blood. So this is a dark field impression of early spirochete, and that's pretty much what they look like under a dark field microscope. And other bacteria will show up as well, strep, staphylococcus, other bacteria. And mold presents in a lot of different ways, but you can see mold under the dark field. You can do urine testing for mold, but it may or may not be that accurate, but we can certainly see that through the microscope. So bacteria release biotoxins, which are inflammatory. The mold releases mycotoxins, which are also inflammatory, and they both create a wide variety of symptoms. Here is one type of white blood cell in the blood, and how it would fight infections primarily is, and there's five different types. They will secrete hydrogen peroxide to kill off bacteria and mold. Hydrogen peroxide will break down into H2O water and what is termed a singlet oxygen, which is a single atom of oxygen which oxidizes or kills the bacteria and mold. In medicine, we have ozone, which is O3, and this breaks down into O2 oxygen and that same singlet oxygen. So we're trying to mimic with ozone, we're trying to mimic what our own immune system, our own white blood cells should be doing, but have not apparently been able to overcome the infection. So again, if we're going to use ozone to clean the blood of various bacteria and mold, we can do this through ozone. This is a unit from Germany called the Zotzmann. We use it for a therapy called the 10-pass, where we're treating about 2 liters of blood at one time. Most people have between 4 and maybe 5.5 liters, so we're treating almost half the blood with ozone to kill off all the bacteria and mold in that sample. We draw out 200 cc's, 1/5 of a liter at one time, mix with ozone, put it back in the vein, bring more blood out, 200 cc's. We do that 10 times, so the 10-pass treating 2 liters of blood. So there's another issue with bacteria and mold. They have been releasing their toxins, causing symptoms, but as these biotoxins and mycotoxins circulate through the bloodstream, the body will sequester or compartmentalize these toxins inside of our cells. So even though we've removed the bacteria and mold from the blood, we now have to work on the cellular level to get rid of the toxins that have been sequestered inside of our cells. So they get inside the cells, the mitochondria will go into a decline in their function of ATP or energy, and in order to get the toxins out, it's an active transport which requires more energy produced by the mitochondria, more ATP, and that therefore we must increase mitochondrial function. But I've covered this in other videos, so I'm not going to belabor the point. So this is how we address one of the causes, underlying infections, primarily using ozone, and then the other purification therapies would help to get the residues or toxins out of cells to help recover cellular health and increase vitality, etc., and longevity. And that's it. Thank you.